Now, the public sector strike has been marred by violence and intimidation. It's now impacting various hospitals, including Charlotte Maxeke Hospital. We're hearing that Gauteng Health has obtained an interim interdict from the Labour Court against Nahawu. But let's get the very latest now from eNCA's Moloko Moloto. You can see by the backdrop there, he's in the same space where the Health Minister was. The Health Minister very much inserting himself into this strike action this week, with Charlotte Maxeke Moloko very much being front and center as the place where all of this standoff now is playing itself out. What is the latest from your side?
That is very correct, Marcel. Charlotte Maxeke is one of those hospitals that were hit hard by this ongoing strike by particularly members of Nahawu. The Minister of Health, Joe Pahla, was here last night, and because we are told that yesterday, according to him, using his words, this hospital was under siege. However, he says today things are a bit easy, and we have also witnessed ourselves as we were entering, while we were also outside, the picketing members were really not stopping people from coming in. But yesterday, the story was different. And as the officials here were explaining, a lot of people, patients, as well as the workers who had decided not to go on strike, were physically prevented from coming into the premises of the hospital. The police were nowhere to be seen. In fact, if you would have listened to the minister, he was so frustrated at the fact that the police did not intervene. And only even today at one of the hospitals, I think it was Helen Joseph, the minister is saying even this morning there were striking members of Nahawu who were stopping people from accessing the hospital. This is despite the fact that the Gauteng provincial government obtained a court order interdicting the members of Nahawu from preventing the workers and the patients from coming in. We are told that that particular court order even instructs the police to do their work. Marcel, you and I know that the job of the police is to prevent crime, but also to maintain law and order. And I put it to the top brass of the SAPS, specifically the District Commissioner of the SAPS, Major General Max Masha, here to explain why the police failed. And he's saying, look, the police were stretched, and as the police, they will also investigate to see where the lapse could have been. But let's speak to the CEO of the Charlotte Maxeke Hospital. Her name is Gladys Bugoshi, just so that we can understand the impact of this ongoing strike. Ma'am, thank you so much for making time. You do time and again accept particularly or treat patients, cancer patients, who I understand come from various parts of the country, as far as Mpumalanga and Northwest. What was the impact since this strike started?
Good morning to you and to the listeners. Thank you for the opportunity. Charlotte Maxeke is one of the two hospitals in Gauteng that treats patients of cancer in terms of medical oncology and radiation oncology for not only Gauteng but for other provinces. And so the impact yesterday was that some of the patients had left, those, for example, from Mafikeng the night before. They were already here. However, the people who were supposed to prepare them for their treatment could not access the hospital to prepare for their treatment that was due on the day. As a result, they had to be rebooked on the other day. So
in other words, they left without being treated for cancer?
Yes. In medical oncology, for them to be treated, you need the lab to do their tests first to see their toxicity level. And then the pharmacist, the doctor will then be able to get the pharmacist to mix the correct dose of medication. So even though the doctors were here, the pharmacists were not here, nor the lab people to do the preliminary work to prepare for the treatment.
What are the implications, particularly for those cancer patients who couldn't be attended to?
Obviously, their treatment is disrupted, because how their treatment is done, it's done over a certain period of time with certain intervals. It means that intervals changed, and therefore now we have to do catch up. But remember, on the day that they are going to come for checkup, it means there were other patients who already were booked for that day, which means the staff on that day will have to do double the number to accommodate those who were unable to receive their treatment yesterday.
Mothers had to give birth. There are people who were in ICU, and we heard that in some instances they were not attended to, the adults and the children. Tell us more about that. How were you dealing with that difficult situation?
Our maternity delivers quite a lot of complicated mothers who normally need a Caesar operations. But even if it's not a Caesar, they need highly specialized doctors. In the labor ward, we only had about 2 nurses who had to manage the already patients. 2 of them were already induced. One, actually, some of the people who were outside managed to sneak in the patient who came, I think, from Hillbrow. And so those 2 nurses had to deal with those mothers who were already at an advanced stage of delivery. But there were other mothers who were already sitting there. And remember, when you deliver these babies, you need what we call packs, sterile packs, to make sure that they do not get infection. Our main concern was that already 5 packs were all used, and the patients who were there were about 4 of them. We need operators to go and sterilize those packs. And the domino effect of it was that in the evening, we were not going to have enough packs to bring in those patients who either needed to be delivered in the evening or this morning. The second thing in labor ward is that it's an area where there's a lot of blood, so you need a lot of linen. We could not access linen, and therefore we had to actually take linen from other wards so that we ensure that we use clean linen for the new patients. In terms of the critical care, this hospital runs 84 critical care beds. Many of these ICUs, they had either 1 or 2 nurses. Remember, patients who are in critical care, they are all on ventilators or they are on high alert because they have to be observed every hour. Now, if you have 1 professional nurse who has to look after 10 patients, it is impossible for them to do that.
Ordinarily, how many nurses should man these critical wards if you say you only had 2 for many of those wards?
It depends on the acuity levels of the patients. When we have a patient who is fully ventilated and we have a one-on-one, so 1 nurse looks after 1 patient for the whole day. But if you have somebody who is a little bit better, let's say moderate, you may have 1.5 nurse, maybe the 1 nurse looking after 2 patients. And those that have been extubated and, we are now observing them almost about ready to go to the ward, you can have 1 on 3, 1 nurse looking after 3 of them. But remember, in ICU, all the times the condition can change. That's why you cannot actually say, I need 10 nurses. You may need 10 nurses, but if 3 patients crash, then you need to upgrade and now have one-on-one on those patients. So it's a very fluid area. For example, yesterday, I understand we had 5 patients who crashed. What that means is that you had to elevate, you needed to have nurses who came to resuscitate them, and I'm very grateful that all of them were saved. They were successfully resuscitated through the help of the matrons who had to take over.
All right, let's finish, ma'am. This morning, I did not witness much disruptions, really. I could see some of your employees coming in. For patients who had intended to come to hospital, what would you say to them? Would you advise that they come? Do you have enough people? What is the situation generally?
From the dipstick that we did in the morning, majority of the people are inside. Yes, we are encouraging people to come to the hospital, even if we will not be able to see you on that day, because it's important for the doctors to review you and say, if we have more than 100 that we have to see, to prioritize those that must really get treatment, but to give you another date to be able to come back.
Thank you so much. Gladys Boroshi is the CEO of the Charlotte Maxeke Hospital. We heard from the Minister of Health, Dr. Joe Phaahla, saying as of this morning, about 4 people died from various parts of the country as a result of this ongoing strike.